Hi, my name is Adam Cox. I am the founder of HypnoSlimming and the UK's leading expert on weight loss hypnosis. This is a video about how gastric band hypnosis compares with weight loss surgery, also known as bariatric surgery. And the question really is whether or not weight loss surgery really is the answer. I originally wrote this blog post just over a year ago. It was 2 days before Christmas, and the news was filled with how weight loss surgery could save lives as well as money for the NHS. And there was various examples of that. And after processing the overall message, my initial response was disbelief followed by anger, and the anger really came from the feeling of how short-sighted we have become, that altering our stomachs is the solution to a fairly simple problem. How is it that as a society we have reached the conclusion that bariatric or gastric band surgery is the solution to weight loss issues? For example, what would be your response if you found out that a pet owner dealt with an overweight dog or cat not by feeding it less or exercising it more, but by taking it to the vet to have its stomach altered with surgery? If you were like me, I think you would feel angry at that pet owner, of the irresponsibility of that pet owner. Now, I specialize in weight loss. I founded HypnoSlimming. I know just how desperate people can be to lose weight when they feel that they've tried every diet, every exercise plan, and they can't follow through with those diets. I get that desperation, but I disagree that weight loss surgery is the answer that it's cracked up to be. It has become seen as a quick fix to the obesity epidemic, and it really isn't the magic wand that many people think it is. So this video is going to highlight the 10 main differences on how gastric band hypnosis compares with weight loss surgery. And the number one thing is that after weight loss surgery, the issues that cause the weight gain are still there. The emotional, the psychological issues are still there. And here is an image of a child. This isn't a real picture. It's kind of like Halloween style makeup, but it's an image of a child with their mouth sewn up. And this for me is quite a powerful metaphor with the issue of gastric surgery. For example, if there was a child that was crying all the time, then in theory you could stop the child crying by sewing its mouth shut. The child would still be unhappy even if it couldn't physically cry anymore. And for me, this is the analogy that I have with bariatric surgery. If you have someone that is eating through anxiety or depression or addictions, and you physically alter their stomach, then yes, they may actually physically be unable to eat as much as they were before, but the issues that led them to gain that weight are still there. You're not actually dealing with the underlying cause. You're just doing what most of the medical industry do, and that is treat symptoms. And I think it would be much more sensible to actually look at the causes of the problem and try and tackle those. So what if the reason that someone put on several stone in excess weight had more to do with their depression, anxiety, a response to a breakup, or other psychological or emotional issues than it did to food or overeating? Even if we ignore all the dangers and risks associated with weight loss surgery, the surgery will only affect the stomach of the patient, not the mind. It will not deal with the issues that led to the weight gain in the first place. And that's why I'm so passionately against weight loss surgery. Again, just reiterating that image, it is like dealing with a crying child by removing their vocal cords or sewing their mouth up. It may stop the child from crying, but it doesn't address the reason as to why the child is crying in the first place. Now, the reason why I founded HypnoSlimming really comes down to the core philosophy, and that is, if you change your mind, then you can change your body, and that can be an easy process. Number 2 difference, gastric band hypnosis is safer than weight loss surgery. I'll elaborate on some of the specific reasons in the rest of this video, but gastric band hypnosis is a set of specific suggestions to the unconscious mind that affects the appetite and desire to consume large quantities of food. Weight loss surgery, on the other hand, is surgery that physically alters your stomach, and other than occasional complications with general anesthesia, you have these common issues. Infection affects 1 in 20 people. That's 5%. Blood clots in the legs, deep vein thrombosis, or lungs, which is known as pulmonary embolism, affects 1 in 100 people. I don't like those odds. Internal bleeding, this affects 1 in 100 people. There are things that can take place as part of the surgery itself, in addition to ongoing issues, and several of the clients that I work with and do weight loss hypnosis with have come to me after they've actually had gastric band surgery, and because of some of the painful side effects of gastric band surgery, have had to have it removed, and still trying to deal with the issues of how to lose weight safely and effectively. Another obvious difference is that gastric band hypnosis is less expensive than weight loss surgery. There are different variations of weight loss surgery. You've got, the actual gastric bypass. You've got the bands, lots of different things. Depending on the specific procedure will influence the costs, and there are 2 main methods of weight loss surgery. The first is restrictive surgeries, which work by shrinking the size of the stomach and slowing down digestion. A normal stomach can hold about 3 pints of food, and after surgery the stomach may at first hold as little as an ounce, although later that could stretch to about 2 or 3 ounces. Now, obviously, the smaller the stomach, the less you can eat, and the less you eat, the more weight you lose. Now, the second approach is malabsorptive or restrictive surgeries, which change how you take in food. Now, they give you a smaller stomach and also remove or bypass part of your digestive tract, which makes it harder for your body to absorb calories. Now, doctors don't do purely malabsorptive surgeries, also called intestinal bypasses anymore, because of the side effects. Now, the 4 common types of weight loss surgery are the gastric bypass, the laparoscopic adjustable gastric banding, or the sleeve gastrectomy. And the fourth one is the duodenal switch with bilipancreatic diversion. Now, these typical procedures can vary between about $4,000 to £9,000. In dollars, that's about $6,000 to $15,000. Gastric band hypnosis is much more cost effective and will normally take anywhere between 2 or 3 sessions. The package that I offer is a 5-session package where about 3 sessions are focused on the gastric band procedure itself. And the first session is a strategy and planning session, and the fifth session is dealing with other parts of the process, which may deal with emotional eating or other parts, but I generally have a 5-session package. Depending on the suggestibility of the patient, the procedure can occur in just one session. I have an extended session for doing that, and feel free to visit the HypnoSlimming.com website for the cost that I do for the Hypnosis Gastric Band. There are physical scars that are left, so difference 4 between hypnosis and surgery. Gastric band hypnosis doesn't leave scars. The trauma of going through surgery can leave emotional scars as well as physical scarring. Physical scars, of course, will fade over time, but any weight loss achieved as a result of surgery, which restricts food intake, may seem like a hollow victory. Obviously in medieval times, there was chastity belts which were kind of enforced on women. A woman being proud of being celibate while being forced to wear a chastity belt doesn't make any sense. But at the same time, how much success can you feel from losing weight if you've done it as a result of physically altering your surgery? You may have got the outcome that you want, but not necessarily in the way that you want to lose that weight. Yes, there is the medical technology to help with weight loss, but the last 30 years have seen massive advances in how psychological treatment can help with weight loss. Hypnosis, NLP, gastric band hypnosis being just 3 examples. The question I would ask you at this point is, if you had a choice between losing weight with surgery or losing weight by shifting how you think, which would you prefer? Weight loss surgery, difference number 5. Weight loss surgery can lead to gallstones. This is an image here of the gallbladder, and some of these gallstones obviously quite large there. Around 1 in 12 people develop gallstones after weight loss surgery, typically about 10 months after surgery. Gallstones are small stones, usually made of cholesterol, that form in the gallbladder. In most cases, gallstones don't cause any symptoms. However, if they become trapped in a duct, they can irritate and inflame the gallbladder and cause symptoms such as sudden intense pain in your abdomen, nausea and vomiting, or jaundice. So if you have weight loss surgery and you start to go a bit yellow, this is a likely reason for that. Along gastric band hypnosis, I also help patients to live healthier lives, reducing the likelihood of issues like gallstones. Gastric band hypnosis doesn't have the risk of stomal stenosis, and I don't know if you can see this image here, but this is a serosal tear, and this has occurred directly as a consequence of weight loss surgery. So a common complication in people with a gastric bypass is that the hole connecting their stomach pouch to their small intestine becomes narrowed and may get blocked by a piece of food. This is known as stomal stenosis and is thought to occur in 1/5. That's 20% of people with a gastric bypass. This is one of the reasons why gastric bypasses are not normally recommended to the extent that they used to be. The most common symptom of stomal stenosis is persistent vomiting. Stomal stenosis can be treated by directing a small flexible tube known as an endoscope to the site of the stoma. A balloon attached to the endoscope is inflated to unblock the stoma. Now, the best way to prevent stomal stenosis is to always cut food into small chunks, chew the chunks thoroughly, and avoid drinking during the meals. Now, this is, a lot of people will choose gastric surgery or weight loss surgery because they think it's a magic wand, they think it's a quick fix. It is not. There are side effects, there are ongoing maintenance issues, and you still have to think a lot about how you eat to avoid future issues. Difference number 7, gastric band surgery can lead to food intolerance. Around 1 in 35 people with a gastric band develop a food intolerance, often many years after their surgery. A food intolerance is when your body is unable to tolerate certain foods, such as red meat or green salad, resulting in a number of unpleasant symptoms such as nausea, vomiting, or gastroesophageal reflux disease. Now, the reason why food intolerance can develop after surgery isn't clear. In most cases, avoiding foods that trigger reactions should improve symptoms, but if you have persistent symptoms associated with a number of different foods, it may be necessary to actually remove the band and replace it with a gastric bypass. And as you've seen before, the gastric bypass has its own potential issues, including the one that we've just seen up here, stomal stenosis. So it has these consequences attached to it. Difference number 8, gastric band slippage is possible with surgery, but not with gastric band hypnosis. Now, gastric band hypnosis is a metaphor that the unconscious mind accepts, which encourages you to have smaller portion sizes. Now, there isn't actually surgery that takes place. It's just a metaphor that the unconscious mind buys into. It doesn't need to be true for you to believe something and act as if it's true. And I want you to remember back to when you were a child, getting excited at the prospect of Santa Claus. Even when you probably knew that Santa didn't exist, you probably still got excited at the prospect because a part of you wanted to believe, because it was in your interest to have that belief. Unconsciously, we have many beliefs that aren't true that we still hold on to. And when you have these beliefs installed, particularly metaphors that are installed unconsciously, it can completely change behavior. But there are no medical side effects of a belief system other than you lose weight safely and healthily. But where you actually have the surgery, you can have slippage. Now, this is a diagram of how a lap band slips. So it's normally positioned at the 45-degree angle. But if you were to overeat against a tight band, the stomach is pushed up to accommodate more food. And then as it flattens, it slips. Now, gastric band slippage is a complication affecting around 1 in 50 people with a gastric band. It slips out of position, and it can cause symptoms such as heartburn, nausea, vomiting. Now, here's the most important point here. Further surgery will be required to repair the band, which of course means more risk associated with surgery and damage to the body. Worst case scenario of gastric band hypnosis is that after months or even years after therapy, you may slip into old habits. Then you can just have a refresher session, and you get back to how it was before. With surgery, it's dangerous, and it does have side effects. It is not the quick fix that the media would have you believe. Difference 9, number 9, there is a genuine risk of death with weight loss surgery. Now, this is what the NHS, if you're watching outside of the UK, it's the National Health Service, the UK health body. It's what the NHS says about the risks of death for weight loss surgery. No surgery is entirely safe, and all surgical procedures carry a risk of death. However, the outlook for weight loss surgery has greatly improved with modern techniques. The risk of death in hospital after having any kind of weight loss surgery is about 1 in 1,000. Now, the odds of winning the lottery are 1 in 14 million, meaning you are 14,000 times more likely to die of weight loss surgery than win the lottery. Again, I don't really like those odds. Not when then there is a safe, healthy alternative. Complications of weight loss surgery that could lead to death include a pulmonary embolism that causes serious bleeding, breathing difficulties, and then death. That's that clot inside the lungs. Internal bleeding, infection, a heart attack, a stroke, and a number of risk factors have been identified that increase the risk of death during or shortly after weight loss surgery. And these are being over 45 years old, having high blood pressure, having a BMI of 50 or more. This is the kind of super obese level. Being male, as obese men tend to weigh more than obese women, and having a known risk for a pulmonary embolism. Known risk factors for a pulmonary embolism include having a previous history of blood clots, pulmonary hypertension, where the blood pressure inside your lungs is particularly high, or obesity hyperventilation syndrome, where you have persistent breathing difficulties related to your obesity. Now, the risk factors above can have a significant impact on your individual risk of death. However, untreated obesity, especially morbid obesity, carries a significant risk of premature death itself. Now, this is the NHS saying, yes, it's risky to have weight loss surgery, but they're also saying it's risky to remain obese. I would agree with both of those, but that doesn't mean that it's worth taking unnecessary risks with your life to do surgery when there is a viable alternative that doesn't carry any of these risks. You know, I don't like those odds of death. Difference number 10. This is personal pride and self-confidence. Now, I like Paul McKenna. He's one of my inspirations for becoming a hypnotherapist. Some of his techniques are innovative, empowering, and most importantly, deliver results. The challenge I have with Paul McKenna is that in a lot of his books and TV shows, it's him that will change you. So books and TV shows like I Can Make You Thin imply that he is the hypnotherapist that is doing the change rather than enabling you to make the change yourself. Now, the reason I operate in a slightly different way, my role is to empower my clients to change. The reason why I ensure that my clients know that I am helping them to make the changes is that by my clients taking ownership of the changes that occur, they get an incredible sense of self-confidence and personal pride, and it can become the first step of a chain of events based on an empowering interpretation of what they've achieved. It's best represented as a question. If I have accomplished this, then what else is possible? If I have lost this weight that I didn't think I could lose, then what else could I do? For example, if you've lost 3, 4, 6 stone as a result of changes that you've made, then this question holds real power. If, however, you ask this question after going through weight loss surgery, and you said, well, I've lost all this weight because of the surgery, and you ask the same question, I've accomplished this, then what else is possible? Then you're likely to look for the next quick fix. Now, the mission of HypnoSlimming is to help you achieve the body that you want, to really appreciate the body that you have. We are here to help you on a journey of positive change, acceptance, and inspiration. And I'm very passionate about the subject of weight loss surgery. Hopefully that's coming through in my voice. I think it is incorrect to assume that it is a quick fix or a quick answer to the issue of weight loss. And if you are currently considering weight loss surgery, then I would really, really encourage you to exhaust every other avenue first before you go ahead with surgery, given the risks and the long-term effects it will have on your body. If you are watching this and you are currently considering gastric band surgery, and even remotely the idea of gastric band hypnosis or weight loss hypnosis is starting to appeal to you, then I'll say visit HypnoSlimming.com, and if you visit the site, you can take a free test. The test takes 60 seconds to complete, and that will let me know and you know if hypnosis is a suitable or viable method for you to lose weight. And in addition to doing that test, I will also send you a hypnosis download that will immediately enable you to improve your ability to lose weight on your own, and that will be completely free of charge. So that's hypnoslimming.com. Take the free test, and if you'd like to find out more information, feel free to follow me on Twitter, Facebook, or subscribe to the newsletter, and that's just search for HypnoSlimming on Facebook, HypnoSlimming on Twitter, or visit hypnoslimming.com. Thanks for watching.